Nevertheless, as the bill was being considered and the Congressional Budget Office put out a set of cost estimates around it, they noted that they expect reform to reduce the deficit over 10 years and to produce very big savings on the order of $1.2 trillion in the 10th to 20th years. And so one of the charges has been that the costs don't really kick in until 2014 when the exchanges start and the Medicaid expansion starts and premium subsidies start. But in fact, when you look over the longer lifetime of the bill, you see savings start to ramp up. So I think that's one thing to keep in mind to begin with. So really briefly, what does it cost and what is it used for? I think Leighton probably talked about. The funds are of $938 billion altogether over 10 years dedicated to the tax credit subsidies and to the Medicaid expansion and CHIP costs, which are largely picked up by the federal government. Those are roughly about $350 billion for the subsidies and another $430 billion for the Medicaid piece. So those are the really big places that the money is going. There's another couple $100 billion in important investments in the healthcare system, such as creating more primary care doctors, putting more money into prevention, putting more money into community health centers that generally serve low-income and other underserved communities, improving the payment rates in Medicaid for primary care so that people with Medicaid coverage have better access to primary care doctors. Reducing the donut hole in the Part D prescription drug benefit so that seniors who have high prescription drug needs have better coverage in the end. Making investments in comparative effectiveness research so we have better information about which drugs and devices and treatments work best for any given condition that a patient might be experiencing so that we have more science going into the art and science of medicine. And the bill was financed through a combination, as others have noted, of new revenues and savings from the Medicare program. Just to say it's sort of, roughly half and half. When you're looking at the revenues piece, that included pieces of the healthcare industry, so that the prescription drug makers and insurance providers and the device manufacturers are all paying fees that are going into helping finance new coverage. Other employers are paying as well, and most notably through a high-cost plan tax, which was a subject of a lot of debate as the bill was being developed in both the House and the Senate, and then on individuals as well. And so through mechanisms such as raising the deductibility threshold for people who do itemized deductions on their taxes, moving that from 7.5% of adjusted gross income to 10% before you could deduct healthcare expenses. And then most notably where a significant piece of revenue for the bill is increasing the payroll tax for higher income earners and taxpayers and extending that payroll tax to unearned income. So that's going to be a significant piece of where the revenue is coming from. And then there's a number of different savings from the Medicare program. A lot of that is through what you could kind of call traditional savings, such as reducing payment rates to Medicare Advantage plans and reducing the rate at which payments inflate for hospitals and home health agencies and other kinds of Medicare providers. And then there are other kinds that are more sort of delivery system reform savings. For example, the Congressional Budget Office estimated that about $7 billion would be saved by reducing the readmissions rates for people with Medicare, so that if they have a hospitalization, the hospital would be penalized if that person were readmitted again within 30 days. And with the idea being to really produce better quality care and better transition out of the hospital, but certainly savings at the same time. And there's some other savings in the bill which we can talk about if that's useful. But then I think the other really big promise of healthcare reform is to create savings in our healthcare system. And there I think it's a much bigger question of, are those savings going to be realized? The Congressional Budget Office didn't score very substantial savings from those kind of delivery system reforms, largely because we don't have the data and experience from some of those approaches for them to be able to derive any kind of solid cost estimate. But at the same time, a lot of economists believe that the kind of efficiency and administrative savings, for example, that you can get from a health insurance exchange, the kind of savings that you can get by changing payment incentives so that you're rewarding providers more for coordinating care and providing better quality care, will deliver savings, and that the kind of savings that you can get from, again, comparative effectiveness research and things like health information technology. So, for example, a Harvard economist who's also a senior fellow of the Center for American Progress, where I work, has estimated that the total federal budget savings from health systems modernization, like administrative savings and payment and delivery system reforms, are about $6.5 trillion between now and 2030. That's an enormous amount of money. So, and he's similarly estimated that if you even just look out the length of the bill, that you're looking at an additional $2 trillion in savings across the whole system. So these are I think, promises more than a certain easy to grasp, tangible reality of what kind of savings we might achieve. And that makes implementation of these kind of changes all the more important, so that we really can see savings, whether they're of this magnitude or of a lower magnitude. So what this means, I think, in terms of implementation, is that we know that the traditional Medicare savings will be realized. If you look back at previous legislation that has also looked at getting savings out of the Medicare program, those have largely been implemented. Even in the case of the Balanced Budget Act, where there were what were called give-backs later on, and so some of the savings rates were taken down and the money given back to providers. About 80% of the overall savings in the bill were actually realized.